So what is your role for APD? I call you the gatekeepers in the school, because teachers are going to come to you, parents are going to ask, you may suspect, based on your progress with the student or what you're seeing, that auditory processing is there. So I'm going to teach you how to screen for it, to rule it out or rule it in, to decide if it's part of the picture. And then we're going to talk about ways to look at the other potential comorbid conditions. Part of the goal of identifying if there is a bottom-up deficit is for you to add a little bottom-up auditory training to your therapy to improve their skills, but also to give alternate programming for that intense 6 to 8 weeks. And that can be activities you do at home, and I'll share those with you. The most important piece is to provide education. Most of what I do when I evaluate a student is rule out auditory processing. I typically rule it out. Let's stop talking about auditory processing. It's not it. It's something else. And so part of the reason I want you to learn how to screen is if you screen for it and you don't think it's an issue, we can stop talking about it and move on to what might be what I call the student's primary driver, what's driving the most difficulty. The other thing is compensatory strategies. I gave you the example of Oliver. Many times SLPs will say to me, I have a student with auditory processing that I suspect. I can't get them tested. What do I do? And I tell them, at a minimum, you have to help them with compensatory strategies. All of the children on your caseload that have language difficulties, attention deficit, dyslexia, auditory deficits are not going to be good auditory learners for life. Even if we improve their skills as much as we can, they're going to be stronger visual learners than they are auditory. So teach them that. Teach them the importance of adding visual information to what they're doing. It will make a difference.